Welcome to the Social Work Rants podcast, providing a platform for social workers to share their stories. The podcast covers a wide range of topics, including mental health, social justice, policy, and the day to day realities of the profession. Season 10 will continue to focus on the intersectionality of mental health and finances. Hope you enjoy. Hello, social workers, mental health professionals, and change agents. Welcome to another episode of the Social Work Rants podcast. I'm your host, Bass Marino. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to the podcast. I appreciate all the love and support. Gracias a todos por su apoyo. Continue to follow the podcast on social media on Instagram at the Social Work Rants podcast. That is on one word on Facebook, aka Meta. Type in the Social Work Rants podcast. Still on Twitter at Social Work Rants, and of course, YouTube. Hit that red subscribe button, and however you listen to the podcast, share, like, download episodes as well. We talking about housing, and I know we always talking about housing and social work. There's a whole crisis going on in America in terms of housing. So housing is a right for folks. So and we struggling in these spaces. Uh, my two guests at this time, Rosita Marinez and, and Kenia Evans-Pinckney. How you ladies doing?
We are well, ready to talk about
Mm,
housing.
Yeah, doing well. Thank you again, Baz, for another invite. We're ready to talk about housing. It's a critical issue, not only in New York City, but in the states across the board.
Absolutely, and between housing and the wraparound services that a lot of housing programs uh, do throughout the country, especially in New York City. So before we get started on today's topic, Ms. Evans Pinckney, tell the people a little bit about yourself.
Thank you. So, as Baz mentioned, my name is Kenia Evans-Pinckney. I am a licensed clinical social worker. I have been in the realm of housing all of my career. Luckily, my first job out of my bachelor's level service degree was at a CRSRO back in 19 so and so. I'm not going to tell you how long. But I've been doing this since the 1990s. And I have been a case manager, and now I am currently serving as an executive leader at a non-for-profit in New York. And I also do therapy as my after hours work. So I have my own practice, private practice, where I provide therapy to individuals, couples, and some children.
Cool. Uh, Rosita, just remind folks who you are, what you do in our space.
Um, yes. So like Baz said, my name is Rosita Marinez. And been a social worker now roughly the past 20 years. Not gonna count the age, right? Because it's just a number. But in saying that, been in housing now the past 16 years. I really started my career in the HIV healthcare world and then transitioned into housing, mental health, and substance use. I'm currently serving as Senior Vice President for a behavioral health care organization that everybody knows. And so with saying that, I oversee the largest scatter site OMH portfolio in the state for individuals with SMI, as well as our, diverse portfolio and treatment apartment program, and others. So thank you, Bass, for the invitation.
Yeah, absolutely. And for viewers and listeners, for the most part, we'll be talking about New York City and New York State, but housing, like I said earlier, it affects all over the country. So whatever New York's doing, somebody somewhere in the continental U.S. is doing something similar, or might learn something one way or another of whether your state should be doing whatever New York does or not. Um, so yeah, let's get cracking on between just wraparound funds and services. Like, uh, what what exactly do wraparound services? How do they help people? Like, with long-term either homelessness or a history of housing instability?
So I envision wraparound services as just that. I envision it as a big hug for folks that we service. So with that said, whatever we are person-centered folks in the social service industry. So whatever people need, we are providing, whether that's mental health services, whether that's medical services, whether that's childcare services, whatever they need referrals to ensure that they are stably housed. That's what wraparound services means to me.
Yeah, and just to add to what Kenny was mentioned, it's really comprehensive, individualized approach in terms of integrated services. So mental health, substance use, childcare, employment, care coordination, anything that actually can help an individual thrive in the community once they're, establish a home. We always think about and say placement. I really don't like that word per se, personally, and also as a professional, because people are more than placements. This is your home where they're going to be living in the community and hopefully be engaged and, live and thrive. So it's really the supportive services that they need in terms of living independently in the community.
Right. And the National Low Income Housing Coalition has done a study, and 50%, folks are 50% more likely to remain stably housed with supportive services. So that speaks to the quality of the services that folks in supportive housing is receiving.
Yeah. Yeah, and just to add to that, but as we speak about like, oh, let's address like homelessness by building more affordable housing, which is great. We can't forget about the wraparound services. Someone could be, have a home. This might be their first home that they're living independently. Others, they've been going in and out of shelters and in the system, unfortunately, and being rehoused for several reasons. And then saying that we need the fundamental of the wraparound supportive services to help people be able to maintain those apartments and their home, meaning financial management, which is very important, of how to manage your money on a low income, whether it's SSI, SSD, public assistant, or even working, of being able to pay their rent, the utilities, have food on the table, and all of their necessary items in order to avoid individuals of racking up rental arrears and then putting themselves at risk for evictions or going through the whole dreadful aspect of a one-shot deal. So having these wraparound services, in addition to having more affordable units and available units, it's having those services available and in place for them to maintain them housed and living in the community. Yeah.
Can I just add one more
Yeah.
tidbit? Most folks here in New York City are executing the evidence-based practice of housing first, which means we remove all barriers to housing. So if you have a substance use condition, that's fine. We're gonna still assess you to see if you can come into our programs as long as you're eligible. A mental health diagnosis, like our job is to remove barriers. The goal is to house people and not to be focused on the barriers which may affect their ability to keep the housing, right? So most social service agencies in New York City apply the housing first model, which is removing barriers to housing. And with that said, when we remove barriers, 85% of folks that are housed in supportive housing with the housing first model remain stably housed. 85% is a very high number.
No, absolutely, especially when you mentioned substance use, mental health, or no dual diagnosed, like it's or just chronic history of homelessness. That's just all a client would know, and don't know what stable is, and then you place them stable, and it's like it causes them to be unstable because like they got their peace and quiet, and you think like, all right, they're set, and like they're not used to having that like stability, so the self-sabotage comes in as well.
Yeah.
Absolutely.
Okay, can I just add to what Kenya said
Yeah.
about like the housing first model? Because this
Yeah,
actually
what is that?
This actually took place in the 60s. So the Housing First model was, and actually a colleague of mine who was, and ours actually, who was part of HPD and all these movements earlier on. I'm not going to say the name because I didn't ask for permission, but we have several colleagues that are part of that era in terms of like, you know, the 80s, 90s, and seeing how this all started is really, you know, based on all these landlords who were putting all these stipulations of ruling out people and screening people out who were, let's call it for what it is, poor, had a disability, look like you and I, that they consider that, hey, they can't afford the rent, or they're going to be some trouble, or their credit isn't good. So that was the fair housing piece, sorry, the fair housing piece law. The Housing First model was created to eliminate barriers of saying that you have to be housing ready to move into to your own home. There's been a debate of what does housing ready mean. I mean, I know when I was living independently for the first time on my own at 18, I wasn't housing ready. Like, how do you know, like, okay, how to do all your finances at 18, right? How to maintain your own apartment. Like, you learn as you go, right? And with the extra support, you kind of finagle that aspect. So the fair housing piece was really for landlords to stop screening out people with disabilities, poverty, and of course capitalizing on that, which they still do. The second piece of Housing First model is eliminating those barriers, saying that you're housing ready and working with the person where they are in their stage of life, with all the psychosocial aspects, meaning if someone is struggling with their mental health or their substance use or financial management, being able to work with them while they have their home, not be housing ready, the perfect model client, which you just mentioned about, you know, in that area, to then housing them. So with that being said, it's a model that's been actually effective, and wanted to add to that as of 2023, we have the low barrier in New York City, which even reduces the barrier for certain areas of unable to be ruled out, meaning, okay, if someone is not sober, or if someone's coming from Rikers Island, or if, you know, someone has a forensic history in terms of certain area where they can or cannot live. So the barrier there's an official barrier that came out to New York City in 2023 that all of us need to follow those guidelines to be able to remove those barriers that exist, but you don't see them, for people to get equitable housing and services.
Yeah, it's very interesting to to say the least.
And
Um,
just to add to that, Baz, we
uh-huh.
like all providers, we have contracts with different funding sources from federal, state, and city, and it's something that for New York City, the city wanted to ensure that we're not adding extra barriers to what already is being encountered.
Right, because New York City has one of the highest level of
Yeah.
the homeless population, so we're trying to eradicate homeless, right? That's why we have all these providers. So adding barriers is just going to be a deterrent from our mission, which is to eradicate homelessness.
Yeah. Speaking of barriers, that Agent Orange in the White House has his administration caused like any ripple effects to the city or the state yet in, in terms
Yeah,
of housing?
absolutely. I don't know about Rosita, but I've been pulling a little bit of hair that I have out. Because the situation changes from day to day, minute to minute, hour to hour. The agency that I currently serve as an as an executive leader, we have most of our agency is federally funded. So if there are policies that are going to be enacted that don't really serve the people that we serve, that look like us, right, the people of color, that's going to have a detrimental impact on our ability to sustain. So yes, there is a lot of barriers, there's a lot of uncertainty, there's a lot of anxiety, there's a lot of everything going around on a day-to-day basis, because of all of the evolving changes in the current administration.
Yeah, and just to add to Kenya, so as I serve an executive leader, we have federal, state, and city. The bulk of our housing contracts come from the state, so we haven't experienced that, knock on wood, in terms of that. For our federal contracts that we do have at a HUD level, and yeah, this person has mentioned about like reducing and eliminating funding, which will impact the HUD funding, and
Mm,
which will impact Black and Brown communities and communities who live in impoverished communities, as well as disability. It will impact all of us at one point or the other. With that being said, just like Kenya mentioned, you got to take things day by day. We're not really worrying like in the what ifs and what happens and things like that. It's really focusing on the here and now, and then also really preparing us that, if that time comes, how can we continue sustaining these contracts with just, other type of funding that we can supplement, and continuing to provide those services to our clients and keep our staff and employed. With that being said, we really don't know at this point like the impact that it may have, because as we all know, like 2025 hit us like a smackdown of WWE bass, like boom, like The Rock would
yeah.
say. And then we're just going like trying to like keep up of like every single day of what's
Mm,
going on. So with that being said, and like Kenya mentioned, it's just taking things day by day and prioritizing, and definitely having a plan in place. For bigger organizations like myself, like we have the different revenues that could be sustainable. However, for smaller organizations and
mm,
mid-size, the concern is there because they're literally just, living off these contracts, and 1 and 2 contracts or 3 can impact a lot throughout the organization. So this is bigger because it not only impacts housing, it impacts just social service in general, uh,
right.
with comprehensive wraparound services. So if we don't have the funding for, housing with mental health and substance use, it just is a trickle down effect.
Right, right. And I wouldn't necessarily equate it to larger or smaller.
Yeah.
Um, a portion of the agency that I work for, 8.9 million. That's not a small number. 8.9
Yeah.
million. That's just one program.
Yeah.
8.9
Mm,
million is coming from federal funding. So again, I just think that if your agency just happens to have a lot of federal funding, that you're at risk, and where we are pouring our resources into is contingency planning, to see how we can sustain. Because could you imagine
Yeah.
social services programs going out of business?
Yeah.
Where would all these people go?
mm. It, it would be a reminder of me of the Great Recession in '08, where a lot of preventive services agencies in New York City, they lost their funding or had to like merge with other companies, or just close
Mhm.
programs altogether. So
Right.
there's potential of that happening.
Yeah, and can I just add to what Kenya said? Because I didn't want to like break it down like that, because one contract could be millions of dollars, just like Kenya mentioned, and it impacts at whether you're very large, 200 and plus, to the minimum of 1 million and less. Is that these contracts, whether federal, state, and city, you're talking about 2, 3, 4, 5, 8, $10 million. But that includes, I just want to people might hear the number like, oh wow, that's a lot of money, but we need to have an equivalent this to, we pay rent, right? We pay insurance, staff lines, everything that comes with it, and it's very like control in terms of how you spend the money. That's one. Two, like you can't go over your budget line. The rents, especially in scatter site, you can add to this, Kenya. Scatter
Yeah.
site, we have specific lines for rents in terms of how much we could pay. We can't go over the rental line, and then we also have to, just take that into factor that not many people pay their rent. So it's not like, like, okay, we're putting out the money to ensure that the rent is being paid and people are housed. The 30%, which is the fair aspect in terms of federal guidelines, is something that we put back into the bucket to continue in terms of the rental aspect. So it might sound a lot, but it's really not a lot of money when you factor all the aspects aspects of wraparound services, insurance, rent, and everything that comes with supportive housing to continue delivering that service.
Right. So just to tap into the rent, everyone knows that it's very expensive to live in New York
Yeah.
City, right?
Yes.
So the fair market rate that we are given doesn't necessarily align with what the rents are in New York City. It has increased over the past couple of months, so I'm super excited about that. But we were definitely hitting our head up against the wall recently because the money that we are provided from the federal government, the whomever, doesn't necessarily align with the FMR.
Yeah.
So we're charged with finding housing when we don't have enough money to secure the housing based on the market rates in New York City. Granted, like I said, it has increased, but it has been a struggle for a very long time to house folks because it's very expensive to do it.
No, I absolutely. When you mentioned the numbers of millions of dollars, I mean, me as a native New Yorker, I was like, no, that's not that's not a lot of that's not a lot of money, especially everything that has dramatically, increased. And just to add that, New York politicians or just politicians in general don't know what the word affordable really means. That's been my biggest issue with
Correct.
especially in New York City. That is both Democrats and Republicans. They don't know the meaning of what affordable is, and it's just we see it with the lotteries that they do, the housing lotteries, and just in general. It's a lot to build a new housing program or a new housing development from scratch. And there's certain organizations throughout the city have been doing that, and that costs money.
Yeah.
It does.
And can I just add to like what you were saying is in terms of you're not talking about 10 or 15, you're talking about 50, 60, 70, 80, 90 beds or whatever it is for that amount of money. And the rents go up and the landlords want their money and you try to negotiate as much as possible in terms of that. If you're like, overseeing low income tax credit buildings, there's all this compliancy that comes into place and HPD vouchers if they're receiving that. And just the maintenance of the building. So in terms of like, being able to fund these programs, there's more behind the scenes that people don't really understand in terms of compliancy, in terms of rental payment and everything that we need to follow, with state, federal, and city guidelines. But to your point, Baz, yeah, we need to take those into account because the rents are not going any lower, they're going more higher. So I'm going to give an example. It's like for $2,000 you get a single studio or a bedroom, and that's not in the best area either. You got to see the area. So many of the programs or supportive housing are now doing like, buddying up where you have to do roommate situations because they're only paying you $2,000 to house 2 and 3 people. Like, where are you going to actually find that level of rent? So with that being said, we do need to keep our funding because then what happens then, we want to maintain people with a home and house, but if they're removing this is going to actually exacerbate, in terms of homelessness, which we've been encountering the past couple of years or decades, really.
Right. Right. And just to piggyback, I know we've been piggybacking a lot. But just to piggyback on what Rosita said, she mentioned that the housing that we are able to afford might not be in the most desirable areas. And therefore that's when our advocacy comes in, because I have encountered, Rosita, you can tell me if you have a different experience. I have encountered landlords that think because we are not in the most desirable areas, that they can lack on repairs or not have the building clean or, this, that, and other thing. So not only are we advocating for increased funding, right, so we can get the housing that we deserve for our folks, we are also advocating for just regular treatment from our landlords, for them to be responsive, for them to understand that a family might be moved because there is a leak or some lead or whatever the case is. We do a lot of advocacy for the apartments that we have, particularly the old apartments that we have. 'Cause I have apartments that, span across New York City that are older than me. So with that become, not that I'm old, by the way. I don't know, but that's that brings issues, right? Because
Yeah.
structurally they're built sound, but lead may become an issue. Leaks become an issue. Just the area and where they are housed might be an issue. So
Mhm.
we are advocating on all fronts with the landlord to make sure that our folks are treated fairly and with
Mhm.
respect. We are advocating in Albany. I saw Rosita there recently, to make sure that we are advocating for policy change. We are advocating for our funders to make sure that we are given the adequate amount of funds to ensure that we can be in undesirable areas. That's all we do is advocate for our people.
Yeah, and to answer what Kenny was saying, it's like we all go through that, Landlords think because we're housing people with disabilities, that they don't deserve to live in a habitable environment. No, that's not the case. Everybody needs and deserves to live in a habitable conditions. That's number one. Number
Basic.
two, yeah. And number two is that they kind of like identify, oh, that's a program. Well, I mean, it's a program because you see people coming in and we're not identifying ourselves with a sign, but because we have long-standing relationship and many of these apartments are older than us, then they already have a precedence that, oh, they've been leasing out to programs. That doesn't mean anything. That means that the person needs more support to live in the community. With that being said, we do find that and we need to advocate continuously, like Kenya said, whether it's in Albany, whether it's in city council or a council, whether it's with the network, signing petitions or ACL or Unity and Alliance or other groups, we need to do that in order to continue the funding. With that being said, it's not only the apartment or the rental subsidy, it also comes with the bonus of supportive services, right? So meaning you have a case manager or a social worker that can connect you to mental health, to substance use, to care coordination, to health, to social supports like clubhouses. So it's not only the rental aspect, it's also the wraparound services that people need in order to continue living in the community. And without that, it's not only the apartment, it's all the wraparound services that we're providing our clients that they need, this level of service.
Absolutely.
Right. And you led right into my next question in terms of the role of social workers and care managers and care coordinators, whatever you want to call them. I mean, I worked as a social worker at a housing program a couple of times, so there are social workers there, and especially in New York City, especially organizations that you guys work for that are been building up programs and housing programs, for years and continue because the need is there for housing. So obviously, with the need being there, obviously you would need more people, hence more social workers, care managers, or if you got your MSWs and start, your career in housing, which a lot of people actually do. So, how can social workers, care managers, how can they advocate for individuals in these housing programs to ensure they receive the necessary wraparound services?
Talk to anyone that will listen. Like I think Rosita and I have been speaking towards advocacy throughout this whole podcast, right?
Mhm.
Whoever will listen, that's who we need to speak to. Particularly folks that have the power to make change. That's why we go to Albany. That's why we go to the council folks. That's why we talk to our funders about the gaps in funding, right? Whoever will listen, the advocacy will never stop as a social service provider, period. Because most times the funding is going to be inadequate for the enriched services that we would like for our folks to receive.
Yeah, absolutely. So when it comes to wraparound services, it's like social workers, care managers, care coordinators, social service staff, or just human service staff is very important in order to provide, individuals living in housing, not only in housing, and just the work that we do in order to navigate the system. One thing that I always say is that, look, you need to advocate and be able to have the voice and have the seat at the table. We all have the right to be part of this table of discussion in terms of different areas. When it comes to like social workers, we just came out of Social Work Month, right? We were celebrating for 30 days. And actually, I put this on my post on LinkedIn. It shouldn't only be for 30 days. It should be a year round. We should be celebrating our human service, social service staff. That's number one, for all the hard work that they do, because the work is real. Like, I remember like when I started my career in terms of like working in the hospitals and HIV was hard, doing like 2010Es, getting calls. Back then it was like, the whole little beeper they had and whatever it was. You guys know what I'm talking
Beaver,
about.
oh my God.
Yeah.
A beaver, yes, I remember them.
Yeah, and I was an intern, and they hired me, and I was like, well, okay, well, this is great. My first job, so happy of trying to like, help people who were diagnosed with HIV and AIDS get health insurance, just a basic aspect. With that being said, it's like we need to really continue to fund these wraparound services, because our employees are the ground on the boots, our social workers, our human service workers, anyone who works in the social service sector, nonprofit, are our boots on the ground staff who go out there, do home visits, knock on the door, see how our clients are doing, or even working in, congregate settings to continue to function. So with that being said, it's like, it's necessary, because if we didn't have the wraparound services or enhanced case management, like many of our folks wouldn't be able to like thrive independently.
Absolutely.
That's the reality. Many people don't have family, number one, feel isolated, they're not connected to anyone or a community. That home visit, whether it's once a month or bi-weekly, means a lot to someone, right? Connecting someone to a care coordinator, one, or a mental health practitioner, or a pros, or a clinic, that might be like the only thing that the person has to expect for their appointments, because they don't have a lot of social connections. So being able to navigate that, is very complex. I know when I do things for myself and having to call health insurance, oh, you've been denied for this. I have to be advocating for myself of like, well, I need this, health, this to be approved because it's for my health. So imagine someone who doesn't have the resources, that has SMI and other things going on. How are they going to advocate for themselves?
Absolutely.
Can I just tap in a little bit?
Yeah,
So
of
I just
course.
want to make a distinction. Like Rosita was talking about isolation, and yes, folks that have like disabilities or some mental health challenges have always faced isolation, but particularly since the pandemic. Like we just went a couple of years with everything
You
being,
read my mind. I was about to go. I was about to go there.
yeah, we just went, and it was just like this. Like New York is always hustling and bustling, and then it was just everybody's home, right? So could you imagine going from the hustle and the bustle and just going online for what, a year and a half or so, maybe two? That was a shock to everybody's system. So now having folks that are in the programs, providing services, making referrals for you to get out into the community, having on-site events like Thanksgiving events, Christmas events, holiday events, anything that promotes socialization. This is what wraparound services means. It's not just the referrals, it's just the family aspect of the program as well.
No, that is so important, and you hit on the key regarding the isolation, and especially, like I said earlier, a lot of our, working in New York at the time, a lot of comorbidities in terms of mental health and substance use, and the isolation. That you're just isolated. People always want to blame. In case something happens, like on the subway, people want immediately, or anything, they want to blame mental health first. Like, no, like people at SMI, that they want to be left alone. So they don't.
It's not only SMI, like
Yeah,
we
exactly.
as professionals, right? We all have degrees here. But it was a shock to me too. Like I've never
Yeah.
seen New York the way it was in 2020. I've never witnessed that. Like it was a real awakening for me. So I could assume that it was awakening for everybody because you're just a human, you're human at the end.
Yeah, exactly.
Yeah. Yeah, can I just add to that? Yeah, I mean, COVID really hit us like boom, it's here, and it's foreign to us, and we don't know like what's going to happen, and with everything going on, and we managed as much as possible, and had to transition of isolation, not seeing family, not going out because we didn't know what this was, and a lot of people were dying and everything that came with that. So with that being said, it's 5 years. I can't believe it already. It's 5 years. It's 5 years since COVID. It's not going anywhere. But the good thing is under control that we're still dealing with the aftermath of COVID, where that has impact mental health. It has impact social interaction, has increased in terms of substance use and also alcohol use. People, we're drinking a lot more than usual and things like that. Just impact everything in terms of you just living in terms of your daily aspects. With that being said, of what you were mentioning, Baz, because I always hear, oh, it's the mental health, it's SMI, the person, is not doing well. Not everything is SMI. I just want to make that clear. It's not it's not everything is not a serious mental illness. There's other factors that contribute to what's going on with subways and things going on in New York City. And it's not only in New York City, guys, it's just across different states, especially big cities. You got Chicago, you got LA. So with Portland, with that being said, it's other factors like increase in substance use, right? Behavioral issues, yes, underlining, mental health that's not being treated. People just are angry, are angry with what's been going on in the world. And that does not give them an excuse of lashing out, but a lot has to do with behavioral and social behavior of people being upset. Oh, why are you looking, like, I'm going to give an example. Some people, even if you look at them some type of way, they tell you, hey, what are you looking at me in that way? It's just people are very angry. And in that anger, instead of, funneling that or expressing it through therapy or exercise or whatever it is, they're just lashing out, aggressively towards people verbally and physically too with violence. So I just want to make that clear because you always hear, oh, it's someone, serious mental illness. No, the percentage is very small if you see at the data. I think it's about less than 2% from the last time I actually was looking into that. So we can't just group everything and say it's individuals who are mentally ill. You never know who has a mental illness. No one goes around walking around with a sign saying I have bipolar or MDD or, schizophrenia. Anybody, productive citizens have SMI. People with degrees and credentials have SMI. It's just a narrative with the media and everything else going on in the world that is being targeted as this is what SMI people do and this is how they look like and so forth. That's not the case.
No, absolutely. I want to touch on because I obviously New York City has a big mayor race this year, and how that would affect affordable housing, just everything with the wraparound services. Like how do you guys are you guys planning? If you guys are planning, like what would that look like with a potential new mayor in the city?
Well, I think my answer would be the same. We have new administration, the presidency, and we're uncertain. Like we don't know what we're going to be walking into the future. So what we will do is put provisions in place, contingency planning for every type of situation. Our goal as social service providers is to house New Yorkers, whatever that means, that advocacy, wraparound services, providing more housing, whatever that means. And no matter who's in office, where, right? So we need to make sure that we have a collective voice, right? And means to ensure that our folks are taken care of that live with us, and provide housing in New York City. That is our mission, to eradicate homelessness. Any housing provider, even it might not be listed in the mission per se, but that is our goal. We're housing providers, and as such, we provide housing.
Yeah. With that being said, yeah, I mean, this year, in New York City, the whole mayoral seat is up for grabs, right? And not trying to get here political. I'm not from New York, but I work in New York City. Whoever's in that seat, I like Kenya says, we need to be ready. It doesn't really matter who's there or not. We just need to be ready in terms of, one, advocating for more housing, right? Advocating for more supportive wraparound services, being able to be a collective partner with all our providers, at a city and state level. And really at the end, look, the whole aspect of homelessness and supportive services or wraparound services, it all impacts us at the end of the day. So we need to be solution focused in terms of what the real issue is, what are the solutions, and how that's going to play out and make it work. In terms of parties and everything, it's a two-party country that I'm not going to get into, and we could agree and disagree on many areas. But when it comes to fundamental aspects like what? Housing, healthcare, clothing, and food, it's the basics. It's the basic aspects that we at least should be in some sort of agreement that people need these basic things. We shouldn't be debating, oh, does someone need a home? Well, everybody needs a home, right? And what does that home look like may vary for different individuals. Do we need healthcare? Absolutely. We need healthcare. We need to take care of ourselves in terms of our health. Do we need to eat and clothing? These are things that are really basic. And so I don't see that up for grabs. So whoever comes into that position, and that's up for grabs, at least in addressing those basic needs, in addition to whatever else is going on in New York City, we're here to support. At the end of the day, it becomes a social issue that impacts all of us. Whether you live in New York, work in New York, or you don't, it's something that at a national level, it all impacts us.
No,
Right.
absolutely.
And I would like to add childcare
Yeah.
to that list that Rosita said, because without childcare, you can't work.
Yeah.
Exactly. It's a lot of these social determinants of health, and like I made a post a while ago about social workers who voted for Trump, and it's like, how, like, why? It's like you're giving yourselves more hard work by working in the field, because all of these social determinants of health will get cut, eliminated, or potential cuts and eliminated. And we already all burnt out because of COVID and prior to COVID, and it's just everything's making it a lot harder. And like every day, the president's doing something that will have trickle down effects to states and cities like New York, and so it's an interesting time in a whole lot of aspects related to how it affects social work.
And can I just add to that, because I wanted to acknowledge what transpired this weekend about hands off. So we had a hands off rally for housing in March through the network, and all the providers came together with our staff and peers to support the hands off rally in terms of housing. This Saturday, there was a national hands off rally in terms of hands off not only housing, Social Security, food stamps, child care, education, everything that we've been living through the past couple months of cut, and cut. How much can you cut the people, which is our taxes that we're paying into, because I'm not going into the whole billionaire aspect of everybody coming together nationwide to address that. So this goes back to the whole advocacy, like Kenya was mentioned, that we need to advocate at all levels in terms of either petitions, rallies, showing up, because it's not only our voice voices here. It's everyone's voices collectively in order to prevent as much as possible in terms of all these cuts that are going to impact all of us, our clients, our family members, our communities, and will increase homelessness, will increase poverty, will impact more mental health, increase in substance use, and so it's a domino effect at the end of the day. And this also puts more pressure on ourselves here as providers to do even more and more with the little that they're giving us. And also our staff too. It impacts them too, of seeing their clients having, to go through different things. And then if you're saying, oh, I'm going to cut your Social Security, like what are they going to live on? So with that being said, it's a collective voice to the advocacy, to showing up, and to really be able to maintain our funding as much as possible.
Right. Beth, I like your choice of words. You said this was an interesting time.
Yeah.
That word interesting really it intrigues me because it can go either way.
Yeah, I know.
But yeah, this is our time to rise as social workers, as social service providers. This is why we exist. Like, this is a part of the work that we do. Like Rosita was saying, like, it is time for us to collectively advocate, collectively show up, ensure that our folks are taken care of. When I say our folks, I mean our tenants and our staff. Because without the staff, what can we do? We need
absolutely.
services, yes.
So housing programs are no joke, period. It's a lot of work. It's a lot of, policies in terms of, HPD and just cities, state, federal contracts, HUD. It's a lot that goes into it, and you gotta follow the policies, and you just make sure, because you guys get audits, and you obviously got to pass those audits in order to keep getting the funding. So I was just thinking about, any potential cuts to Social Security, and you mentioned earlier about collecting rents. That's what I meant by that trickle down, like finding each client how much they were getting monthly prior, then add whatever cuts might happen. Now you gotta add, kind of multiply that 30% of whatever the amount cut is going to be. So it's just things like that. That's manpower that you need, and time and resources that may not get, because that might get, those resources for manpower might get cut. So it's like, that's what I talk about, the trickle down that has effects to that people don't even like realize or think about it until unless you're like actually like in it.
Yeah, and just to add to what you were saying, we have all these compliancy aspects. People just think like, oh, they'll get housing and the support services, and how do you, they don't really know the back end and logistics of running programs. We get audited from all three identities. For tax credit buildings, that's a whole different other aspect of auditing and compliance, right? Then you have syndicators, syndicators, 30-year mortgage. There's like so many things on the back end with the real estate aspect, brokers fees, property management. You got the facilities. Like this is like real facts that people are not working in the housing world wouldn't know. You have the facilities, you have the property management, you have the leasing, the compliancy for low tax income credit, and being able to pass those audit, the whole fair housing, as well aspect of selection of like 3 candidates. You have to have 3 candidates to 1 unit for those type of buildings. So there's a lot of things that you need to follow in order to, number one, have a real estate portfolio, but also buildings. And then for scatter state, we have rigorous also guidelines that we need to follow depending on the funding source in order to keep people housed. So it's not only, hey, we got them a home and have the supportive services. There's a lot of things that we need to comply in order to maintain our contracts as well.
No, definitely it's definitely a lot. We could continue to talk.
I know.
This is just everything that going on, just state, local, the city, and on a national level as well. But where can people reach out to both of you?
I mean,
Uh,
you can find me on LinkedIn, Rosita Marinez, also on Instagram, Rosita.Marinez. So I could send also my email address, Baz, which you will have. So I'm definitely active on social media, and you can find me there.
right. Same here. My email address is kenia.evanspinckney@gmail.com, and I can put it in the chat as well.
All right, cool. Thank you so much for an engaging conversation, and this was definitely very informative. A lot of fun, and it's a lot happening. Every day is a different day.
Yes.
But thank you both, and keep up
You,
the great work.
thank you
Thank
for the
you,
invite.
thank you. Thank you for the invite. Thank you, Kenya.
All right, thank you.